Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue the series on hypertension, which I began last week. Hypertension is an extremely common disease. Worldwide, 1.5 billion folks suffer from hypertension. And every year, 7.5 million people die of hypertension every year in the world. In this country, roughly 1 out of every 3 American adults suffers from hypertension, and 1 out of every 2 black adults in this country has hypertension. Very, very common. Altogether, there are about 173 million people with hypertension in this country. 76 million has hypertension. 66 million has what we call pre-hypertension, which has to be taken into context because there are several diseases that when one has them, and if you also have pre-hypertension, it has to be treated. So that has to be taken in context. Before I proceed, however, I want to once more share with you this book that I wrote, The Art and Practice of Modern Clinical Medicine, which came out about a couple of months ago now. It's 136 chapters. I wrote it all by myself from the top of my head, and it has basically everything that has to do with modern clinical medicine in this country and around the world. 889 pages. Take a look at it. I'm sure you could find it in local public libraries as well as wherever books are sold, and of course there are always a few copies in my office as well. Take a look at it. If it is modern, high-powered, 21st century clinical medicine you are really interested in, and you should really take a look at this book. There is no subject that has to do with medicine in a clinical fashion that's not discussed in this book in greatest detail. Now, before I again continue, I want to bring to your attention something that happened this past Tuesday evening. I was in Harlem at the historic Sylvia restaurant, whereby I received a Calvert 2016 News Award for outstanding community services for the last 43 years. The award is right there. I just want you to take a look at it. It was amazing because when I just came to this country, the first community that welcomed me was Harlem. I was there, lived on 112th Street between 7 and 8, and a rundown building that subsequently was so bad, I think they wind up to tear it down. And a few blocks away from there, a few blocks away, I would say, between Amsterdam and Columbus, located a school that I'm sure is still there called PS44. This is where I, as a 26-year-old, uneducated young adult, found myself at PS44 in elementary school. That is correct. You say, well, why is a 26-year-old man doing in elementary school? Well, what happened is that I was super, super smart as a kid, and I ended in school at age 5 in the 1st grade. And of course, unfortunately for me, my mother, who was the center of my universe, died giving birth to a 7th child when I was just 7 years old. So these folks, where I was on a pension, we call it, which is a boarding school, they took me out of school, and their plan for me was to become a house domestic. You can't make this up. Being a star in the school, suddenly they wanted me to be a little domestic. Of course, I fought them off, refused to go along with it, and they wouldn't feed me, so I ate in an all-girls school called Antoinette Dessalines. That's the name of the school, where they had a soup kitchen 5 days a week for the homeless and other folks like that. That's where I ate 5 meals per week, once a day, Monday through Friday at noontime. They had some food for us poor people like me, and then of course Saturdays and Sundays I went without food. So I eventually ran away from these people and fought very hard to find in this country, because every morning I would wake up and look wherever the sun was rising, and then in the evening wherever the sun was set. And I say, if that was the United States, sooner or later, one of these days I want to get there because I know I belong in the classroom. That is all I cared about. Money was not the issue, just the classroom. And sure enough, when I came to this country, February, and this country, and then February 22nd, I think it was, March 1960, and of course, first week of March 1960, I found myself in that night school on PS 44, and of course, I spent exactly 2.5 months, and I finished the 7-year program in 2.5 months. I graduated May 24th, 1960, and the rest, of course, is history. So it was really interesting that not too far from that school, here it is, I was being rewarded this award as a Legion, referred to as a Legion, and also a giant in the field of clinical medicine of all things. So there is hope for the young folks who are out there who are struggling. The fact is they have to discipline themselves. It is not a shame or a disgrace to be poor. It is, however, a shame and a disgrace to destroy yourself just because you're poor by indulging in dangerous behaviors such as drugs and alcohol and other bad things. So if for whatever reason you choose to look up to someone who's really been there, who suffered through it, you're looking at me. And if I do it, I'm sure you could do it as well. All you have to do is use the brain that God gives you and then discipline yourself. So someday, who knows, you yourself might wind up being a professor of clinical medicine, M.A.C.P., and then receiving such an outstanding award from a group of black folks. As I took the microphone to speak to them, the thing that I had to tell them is the fact of all the awards that I've received over the years, and heaven knows I've received dozens of them, this one was from a group of black people, my own people, and that made me feel so much more honored that they discovered me. I knew nothing about this outfit, never heard about it. Somehow they found me, and I took my youngest daughter with me. It was really a very nice evening. So again, I just wanted to share that with you. Now, hypertension. Now, the basis for hypertension is basically the human kidney, as I stated last week. There's a gene that I talked about, came up with the idea in my head many, many years ago, in the early 90s, 1992, 1993, thereabout, and I wrote about it in a book, that there had to be a gene that is responsible for retention of salt, that is then lead to the human race the way it was in Africa, not to completely disappear because of lack of water and dehydration, etc. And using my own example, as a youngster from the time I was 9 and a half, working in the field in Haiti, barefooted, no clothes on my back except my little short pants, from 8 to 5. Sometimes the temperature reached as high as 110 in Haiti in the farm. The ground is hot, the hair is hot, your feet are burning, and yet I managed to survive. So when I became a physician, I said, there has to be. How did I manage to survive that? There has to be a reason, because you're sweating so much. I used to sweat so much, the sweat kicked up on my skin like salt. You would take a piece of wood and scrape it off. And somehow I survived. So I said, there has to be a gene in the human kidney. That's all it was. I had no idea what the gene was, but I hypothesized it and proposed it. And sure enough, the powers to be at Georgetown University, University of Virginia, and I think Emory University was also involved in that study. They had access to kidney specimens of Caucasian Americans, Japanese Americans, and black from, I believe it was Kenya. And they grind up these kidney specimens and sorted out the genetic component, and sure enough, they discover the gene, which is now called G protein receptor kinase type 4. That is correct. And this article was published in the Proceeding of the American Academy of Sciences, and that's it. So therefore the essence of the essence and the reason why essential hypertension develops is because of salt retention, which then causes water retention, and then elevation of the blood pressure. So G protein receptor kinase, therefore, is the reason for essential hypertension. And what is interesting about it, this gene was found in the same quantity, the same quality, in all three ethnic groups that were studied. Hence, the reason for essential hypertension in all human beings, it doesn't matter who they are, what they think they may be, is in fact salt retention secondary to G protein receptor kinase type 4. I say this to say that, therefore, then you cannot have essential hypertension without being given a thiazide water pill as your first medication if you have a functioning kidney to treat that blood pressure. And I am fully aware of the fact that to this day, as I speak, colleagues of mine all over the world and in this country in particular are using blood pressure treatment one way in Caucasian, one way in Asian, and one way in black. In particular, they're treating the Asian the same way they're treating the Caucasian, which is completely 100% false. You say, well, how so? Well, the another part of the kidney that we have to understand is something called the renin-angiotensin-aldosterone system. That's the system that really controls the genesis of how hypertension develops, chemically speaking, and how you could block these substances to block the pressure from being elevated. Well, it turns out that you got to go through the renin-angiotensin system to do that. Well, it turns out that all Asians and all black folks, as I stated last week, have low renin, for genetic reason. Asians have low renins because over the centuries, they eat a diet that is very rich in salt. That's the reality. That's who they are. That's their choice. That's the culture. And I respect that. Because of that, that increased salt in the diet suppresses the renin level. And genetic being genetic, which is very adapting and very penetrating, that gene gets transferred to the offspring, and they have low renin. Blacks, on the other hand, because when our forebears, black folks, Negroes, like myself, were in Africa, well, they were exposed to this situation I described before, extremely hot temperature, very little access to water. Water is not very common in Africa to be found. So therefore, God being God, God then created this gene that I just mentioned, G protein receptor kinase type 4, and also God created a situation whereby he has to hold on to salt. Because they're holding on to salt, they have high salt in the system, that then suppresses the renin. Those are the two bases. I don't care what you hear anywhere else, anybody who speaks English better than I can, and there are millions of those, if not billion, they can explain to you, whatever way they explain it to you, that's the bottom line, what I just told you, in my own way of explaining it. That's it. So therefore, then, if you're going to treat somebody, you can't just give them a medication because some drug company says it is good for blood pressure. It may very well be for blood pressure. The question you have to ask yourself, in whom and under what conditions you are going to give them this medication. Okay? So that's crucial. And as I talk about hypertension over the next several months, you will fully understand how crucial this concept really is. The next step you have to say, well, what is hypertension? Well, I just mentioned to you. Hypertension is a system that God creates that allow the kidney is the foundation for the blood pressure, because the kidney produces aldosterone, which is the last step in the renin-angiotensin-aldosterone system. Aldosterone is a salt retention. That's the grandfather of all salt retention in the kidney. Therefore, that then allows us to hold on to water. You don't have to have hypertensive disease, just the general concept. Once the aldosterone allows you to hold into sufficient salt to allow the intravascular system to be expanded so that allow the heart then to pump the pressure it's dealing with. The heart has nothing to do with elevated blood pressure. The heart just doing its job, which is pumping whatever it has to deal with. If the pressure is low, the heart is going to try to pump it. If the pressure is high, the heart can try to overpump because that's why you develop heart disease with enlargement of the heart because the pressure is too high. The heart has too much of a load to pump. Okay? Now you understand that. The next organ that is central to elevated blood pressure is the adrenal gland, which is also have to do with the kidney because the unusual glands on each side of the kidney, that's where they're located, the left side, the right side. And the adrenal gland is central basically to the sympathetic system, which is where adrenaline comes in. But I want you to understand, important though that is the transient system. It's there, but it's transient. Why is it transient? Well, under stress, or if one has a tumor called pheochromocytoma, which is over-secrete adrenaline, that causes the pressure to go up. But it's transient. It's not going to stay up all the time, but it's going up. Like you when you're working, you get very nervous, very upset, or you're working very hard in business or whatever else, the pressure goes up. That's the business of the adrenaline that's being secreted from the adrenal gland that causes this pressure to go up transiently. Okay? Now, you understand the two concepts, okay? One is transient, one is permanent. Okay? All right. Now that you understand that, let's talk a little bit about what's going on in terms of how we evaluate someone to know if the pressure is low or high. This book, chapter 1 in this book is on hypertension. That chapter has 20 pages. I copied it so that I can look through it every now and again to make certain point. Okay, so now, there are two parts to the blood pressure. There's the systolic, which is the upper part. There's the diastolic, okay, which is the bottom part. The bottom part. Now, first thing you have to know in terms, before you even bother to take somebody's blood pressure, using the blood pressure cuff, we need 4 different types of cuffs. You say, well, why so? Well, first of all, you need a small one, small blood pressure cuff, a medium blood pressure cuff, a large blood pressure cuff, and a jumbo blood pressure cuff. The small is for people who have small arms, small individual. The medium is for somebody who has normal size individual, 150, 160, thereabout, who has medium sized arm, bicep, which is what we use. The large one is for people who are obese. They have large arm. The jumbo is for people who are morbidly obese. You need a jumbo. You have to have all these 4 cups in your office or in the hospital to be able, or wherever else, in clinics, wherever you're taking people's blood pressure. Because if you don't, things are not going to be the way you think it is. If somebody has a medium-sized arm, you use a small cuff to take the blood pressure is going to be falsely elevated because the cuff is too small. If somebody has a small arm, you use a large cuff or medium cuff for that matter to take the blood pressure is going to be falsely low because the cuff is too large and so on and so forth. You understand the concept, okay? So when you take somebody's blood pressure, you have to ask the question, what size cuff did you use to take the blood pressure? That's one thing you have to remember. The next thing you have to remember, how did you take the blood pressure? Was the person sitting down? Was the person lying down? Was the person standing? Very important. If somebody is able to sit down, lie down, and standing, they walk around, people come to the office. And the hospital setting, when somebody is very sick, you can't get them up. They're very sick, so you got to take that into consideration. The pressure was taken while they were lying down, because when you take the blood pressure of somebody that's sitting down, the fact that they sit down can cause the blood pressure sometimes to drop. To take that into consideration. When somebody stand up, you're taking the blood pressure can also drop because they're standing up. You have to make note of that, how the blood pressure was taken. Very important, because the blood pressure can drop because the person is standing up, and so on and so forth, okay? Now, also, you have to understand something. When you're taking blood pressure in someone who are elderly, you must take it on both arms. You say, well, how so? Well, there's a disease called atherosclerotic disease. The artery, because you're taking the blood pressure, it's the artery that you're listening to. You're palpating where the pulse is there, you're going to take the blood pressure. Well, if they have atherosclerotic disease, which most elderly person can have. There may be an occlusion. That's correct. There may be an occlusion in the arm of in the vessel and the arm taking the blood pressure. So their pressure is going to be falsely low. The hypertensive you wouldn't know because you take it on your one arm, and unknown to you, there was an occluded artery in the arm that you were taking the blood pressure. So you must take it in both arms. If it's the same in both arms, and then if there's a difference, you must note the difference, and you'll note the pressure with such and such in the left arm and such in the right arm. There's another concept we call the pulse pressure. What is the pulse pressure? The pulse pressure is the difference from the systolic pressure and the diastolic pressure. The older the individual, the wider the pulse pressure. That's correct, because as an individual ages, the elasticity of the arteries decreases. So therefore, they're likely to have a higher pulse pressure. Very, very important, because you have to understand, when you are practicing medicine, general internal medicine, you must treat elderly patients with blood pressure one way, an individual middle age or young adult another way, because the elderly person has occlusion, not only likely to have occlusion in the arm, as I just mentioned, they're also likely to have occlusion of vessels in the brain, etc. You do not want to lower the pressure too low. If you do, they're going to pass out. And once they pass out, they're going to have a stroke. A whole lot of crazy things can happen. So you must handle them very carefully. You don't give them, not only that, you have to know what type of medication you're giving them, which is crucial, but you also must not overtreat them. Don't overtreat them, because if you lower the pressure too low, they need that extra pressure to be able to perfuse the brain, because the blood is going through narrow vessel, not easily to get through. You can't harm them. Remember, do no harm. So therefore, you must understand that you don't overtreat them. If you do, you're going to have an elderly person that's dizzy all the time, can't function, slumbering around. You don't want to do that. That makes no sense, okay? So now you understand. This is some of the basic that I want you to understand. You cannot build a building without the foundation. So I'm giving you the foundation, the anatomical foundation, the physiological foundation, so that when I begin to talk about the nuts and bolts of blood pressure, let me explain something to you. It is not a difficult process. I do not understand why a disease that is so bad, you have to understand, I have here for you statistic that's going to 46%, 46,000 people, 46,000 deaths could be avoided every year in this country if blood pressure is treated properly or is controlled properly. And it's not being controlled properly because people get all tied up in this ridiculous absurdity of racial differences. They take it to all levels. This is a disease that is controlled by a very powerful committee that issues reports all the time. This concept of G protein receptor kinase type 4 that I mentioned to you, that I came up with years ago, almost 20 years ago now in my books. Others may have talked about it in articles or whatever, but I wrote it in a book. Changed the entire way blood pressure is to be treated. Because you can't treat blood pressure properly without putting the thiazide water pill, because the basis of elevated blood pressure, as I just mentioned, is salt retention. Therefore, you must get rid of the salt, and wherever salt goes, water follows. That is no longer an argument. It's no longer an argument. People choose to ignore it because they do not want to treat it. It is crazy, but it is real. Just like many other crazy stuff going on. You can't treat blood pressure properly without using a thiazide water pill, which costs only $7 per month. Can't make this up. $7 for 30 pills. And yet, folks don't want to be treated for blood pressure the same way blacks are being treated, which is absurd. It's ridiculous. It's insane. We all human beings, we all started in Africa at one time or another. We all can choose our background to Africa if we could emotionally deal with it. I did mine. I had no emotional stress associated with it. I was glad to find out exactly where my folks came from. And then you will realize it's absurdity. All these color differences, that's all it is. We all on the inside, some part of us, or major part of us exactly, are African. So therefore, people don't want to treat blood pressure the same way they treat black folks. On the other hand, the vast majority of black folks in this country, no matter the amount of money they have in pocket, no matter how poor they are not being treated properly for blood pressure. Folks seem to associate famous and celebrity with quality care. That's hogwash. The more famous these people are, the more celebrity they are, the worse medical care they're getting, they don't even know it. They jump into a limousine to go and give garbage medical care and come back home thinking that they're getting quality care because it makes them great because they're driving a limousine. I once noticed and actually experienced on a Saturday morning somebody obviously name I would mention who was very famous, who was still alive, trying to get through the White Plain Hospital in a stretched limousine by himself with a driver in front, a stretched limousine. And the poor guy couldn't get the limousine through. He gets stuck trying to go around to get in front of White Plain Hospital. Can you imagine? And it's stretched on a Saturday morning. And he thought he was going to get high quality. Of course, the hospital give quality care, but I'm just giving you the example of how this famous thing can get into people's head. We had to set the guy to get out of there. So the man, he's 30 seconds from the door of the hospital. He wouldn't get out to get inside. He wanted the man to go around in this stretched limousine. The man couldn't because the place was too narrow. These people are crazy. This stuff gets into their head. And in any event, I'm going to stop here. Next week, I'll continue to talk about hypertension. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.